Burkhardt.
Thank you very much, Madam Deputy Speaker. It's a great pleasure to play a part in bringing today's interesting debate to a close. And I'd like to take this opportunity to welcome the Chief Secretary of Treasury to his post. I know that he's been in his post for a few months, but we haven't had the chance to get to know each other. And I must say, Madam Deputy Speaker, I've been very impressed by him. He's a fluent speaker, he's good on detail. This is not sarcasm. I was once warned by Hansard that sarcasm did not come across well in the written record. But I know what it is to be sent out to defend the indefensible. And I can see that he has a fine skill developing in this route, and that he's some way on his way to mastering it. And I just gently say to a man starting out in his front bench career in government, don't get too good at it, because you'll find that your party are going to give you a lot of ample opportunities to be defending the indefensible in the years ahead.
Minister, Shadow Minister. I don't think you're speaking to me when you say you. You're obviously speaking to the Minister opposite. Alex Burkhardt.
It's been a long day, Madam Deputy Speaker. I hope you will forgive me. But enough of these, enough of such pleasantries. This, Madam Deputy Speaker, is a bad budget. It's as bad can be. At its heart is a decision to tax business hard, very hard, to tax businesses and through them workers until the pips scream. A budget which sees the total effective tax rate on low-earning roles increase to its highest level since 2010, hitting working people hard, as the Chief Secretary of the Treasury admitted on Sky on Friday. We know that taxing business is a bad idea. As my right honourable friend from Tatton said earlier, businesses and working people are the dynamo of the economy. If we denude and degrade them, there is nothing for public services to feed on. But we discover as this budget unravels that it's not just businesses that are being taxed. It's GPs, it's care homes, it's hospices, as the honourable gentleman from Poole pointed out. It's dentists, charities, childcare, higher education, school support staff. Now, I understand that honourable members opposite will want to support big tax rises in this budget. But before they vote on them, I ask them to consider whether they want to vote for tax rises on these services. In answer to my honourable friend from Hinckley and Bosworth, who's clearly behind me, the Health Secretary earlier said that he was going to listen to GPs. But either the money for this next contribution is in the budget, or it's not. Either it's in the envelope, or it's not there. So has the thinking been done on this? At the moment, it would seem that all of these services are in limbo. Yesterday, the Education Secretary was asked by my right honourable friend, the Shadow Secretary of State for Education, and the Shadow Minister, whether support staff in schools were going to be affected. She could not answer. These are serious questions. The government must know. The HMT must have this data, and it must publish it. So I first ask the Chief Secretary of the Treasury if he will publish figures on who his national insurance contribution tax rises hit, what the costs are to those services, and whether they will get compensation. As I say, the Treasury must have this data. If he doesn't have the data at his fingertips, I ask him to put it in the library of the House of Commons as soon as possible. Look, we all want better public services, Madam Deputy Speaker. The question is, do we think we can get them if the services I've outlined are being taxed? Without reform more generally, as the Chief Secretary of the Treasury said on television the other day, without reform, money will just follow money out of the door. Now, we're told that Labour does have a plan for improving the NHS. We know this because the Prime Minister gave a speech. He told us on the 11th of September, and he told us that in the spring he would have a plan. And that plan would contain a transition to a digital NHS, moving more care from hospitals to communities, and focusing efforts on prevention over sickness. And who can argue with these very sensible measures? It was very good to read in the budget that His Majesty's Government intends to invest more than £2 billion in NHS technology and digital to run essential services and drive NHS productivity improvements that will deliver a 2% productivity next year. Very sensible. But a strange sense of déjà vu comes out of this, because one remembers that in the spring budget this year, the then Chancellor, my right honourable friend for Godalming, announced £3.4 billion in additional funding for the NHS to deliver 2% annual increases in productivity through new technology and digital transformation across the health service in England. So part one of Labour's three-point plan is not new at all. It's a Conservative initiative, already accounted for by a Conservative Chancellor. On to part two, moving more care from hospitals to communities. On this, the Red Book says absolutely nothing. On part three, prevention, a small increase in tobacco duty and a vaping products duty. Not content with taxing us to growth, Madam Deputy Speaker, the Chancellor intends to tax us into health. But it's all right, because apparently the Prime Minister has a plan to have a plan in the spring. I'll tell you a funny story about the spring, Madam Deputy Speaker. When I was first working as a parliamentary researcher, there was some long-forgotten report that the Department for Children, Schools and Families was producing, and we asked when it was going to be published, and we were told the spring. So we replied and said, when does spring end? And the Department for Children, Schools and Families said, when summer begins. And in this tale, Madam Deputy Speaker, is an insight in the way to which Labour governments think. It's tomorrow and tomorrow and tomorrow, and never reform comes. So that's the plan for the NHS. It's relatively well developed next to the non-existent plan for welfare reform. Now, my right honourable friend, now the Shadow Chancellor, started that work, but now silence has descended. More workers are needed to grow the economy. The OBR was quite clear on that. The Chancellor has chosen tax over employment, and this will not deliver growth. So the government's plans has been to tax, to spend, to think a bit, to set up a website, to get told to serve waffles for every meal, to think a bit more. Then it will be to see if any money's left, and it will discover there isn't, and it will need to increase taxes again. What is becoming painfully apparent is that Labour wasted opposition. It had 14 years to come up with a plan for the NHS, but it didn't, and now it is scrabbling to find one. By the time we see the Prime Minister's fabled plan, more than 10% of this Parliament will have passed, and very little will have been done that wasn't already being done before. The Prime Minister said there would be no extra money without reform, but that's precisely what he's given the country. That is the price of political complacency. This is the price of thinking government easy. This is the price of believing your own hype, and the price of failing to be honest with yourselves. There are some people, Mr. Speaker, who say that the Labour Party was trying to pull the wool over people's eyes. I was one of them. I thought that behind the great ambiguities of their manifesto there would be a game plan. But game plan has come there none. £140 billion of extra borrowing, £10 billion more in higher debt repayments, mortgage payments up, austerity for employers, austerity for workers. A loveless landslide has become a loveless tax rise for the British people, and they will not wear it.